Hi everyone, thank you for watching my videos. Okay, today we are going to talk about the same familiar topic again, heart attack. Now the question is, how did the attack build up? How? What happened? Let's go. The doctor will ask you what we call history, and the history will give the clue to how we got here. The doctor will ask you about the onset of this problem, the cause of it, and for how long. Then the doctor might dwell more on the history of this present illness. Were you sweating? Did you have chest pain? But remember, I said it is silent ischemia. You may not. Any nausea? Most patients might have only nausea. Dyspnea, shortness of breath, autopnea, and when you lay down, you're finding it difficult to breathe. Paroxysmal nocturnal dyspnea, cough, is your heart racing? Any loss of consciousness? Have you been having swelling around your lower eyelids and your feet? Any headache? How about your vision? Is it blurred? And what about claudication? When you walk around, you feel pain at your calf? We'll ask you how many blocks and is it actually with code and all these related questions just to know how we got here. Yes, the doctor will ask you about your past medical history. Have you ever been admitted in hospital on this account? Like I said earlier, it's possible that heart attack may be reoccurring, and we'll ask you if you have any history of hypertension, if you've been diagnosed with hypertension in the past and you are currently on medication, or you have chosen not to be taking the medication, and so on, so forth. And have you ever been diagnosed with diabetic mellitus? Because one of the major troubles of diabetes mellitus, the complication which we call microvascular complication, is coronary artery disease. Any thyroid problem, particularly hyperthyroidism or thyrotoxicosis here. Have you been screened for bad and good cholesterol, and what is the value like? Do you have allergy to any medication because of some of the medications that you might be placed on? Any past surgery in the past, because some of the silent ischemic processes are secondary to past surgery. On any prescribed or over-the-counter medications, because some of the over-the-counter medications can actually worsen heart disease processes for many people. It will likely delve into your family history. Don't be offended. It's part of the process to make sure you are fine and we're able to trace this trouble to its roots. Are your parents alive or are they dead? If parents are dead, do you know the cause of death? If you do, and it is heart attack, at what age? Because the younger they were at the time they died, the worse the prognosis for you now to likely have it. The probability is higher if they died young, and you don't need to bother about family history as your headache for heart attack if your parents were old, I mean 80, 90, 100, before death or before having the heart attack. In other words, let me make myself clear again. If you have a heart attack or you are concerned that you might have a heart attack and your parents died at 85, 95, or 100, you don't need to bother too much about family history about that. But if they have died at a younger age, like 50 to 60, then we need to work more and make sure all other modifiable risk factors are seriously put under check. Then the doctor will ask you about possible history of heart disease in the family, particularly first-degree relatives, coronary artery disease, hypertension, diabetes, thyroid in the family. Don't be offended that, oh, I'm the one that is sick, then what is business asking me about my lineage and all these sort of diseases in my family? It's just to find out the root cause and how to help you better. Then sudden cardiac deaths in the family, if you have any history of that, somebody playing sports or just somebody just collapsed suddenly and couldn't get back, and postmortem or autopsy reveals that it has been a heart-related issue, it would be nice to let the doctor know about that. It's all just to be able to get down to the root. The doctor will also go ahead and probably ask you about social history. And I will just go straight to those ones that will affect your heart right now. Smoking, we've talked about that on modifiable risk factors. Alcohol, and when those questions will be asked, it's likely if you are smoking or drinking alcohol, there might be a suggestion for you to quit or reduce the quantity of your alcohol and work out on how that could be done. Please agree for you to have a good heart. You need that pump. Drugs. Said it under modifiable risk factors. Cocaine can shoot up the BP, can cause myocardial ischemia and heart attack. Diet. Oh, all junk food. No. You can even be referred to a dietitian to help. Exercise. Yeah, reduce the hours on the couch watching TV. Walk around, jog, swim, dance, play, hockey, soccer, just get out there. Stress, reduce it. Reduce the stress. Now, don't worry. The world won't collapse. Don't worry. You'll get out of it. Make yourself happy. Drop anger, drop fear. Just reduce your stress. Because if you stress yourself beyond necessary, you have a heart attack and you are dead, the world will continue. After that, the doctor will do what we call review of systems. We'll ask you about your central nervous system, whether you are confused, you have headache, you have blurred vision, your respiratory system, whether you're coughing, you have chest pain somewhere, abdominal, just intestinal. We'll ask you all sorts of. Don't be offended. They just want to know how far this has eaten deep into the entire body. And with that, you put a check mark on all those systems. And when they're fine, you have no problem. Okay. P is just physical examination. You'll be examined from head down to toe. We'll not be able to do that here. Uh, with time, I'm promising that I will make videos on physical examination and history taking. Okay, thank you for watching my videos. Um, this is part of the treatment, and we'll see you again very soon. Thank you.